What are the causes of NIHL, including TTS? Have you ever wondered what causes noise-induced hearing loss, often referred to as NIHL, and how it relates to temporary threshold shift, known as TTS? Let's dive into this important topic. Noise-induced hearing loss primarily occurs due to exposure to loud sounds that can damage the delicate structures in the inner ear. The cochlear hair cells, which play a crucial role in converting sound vibrations into electrical signals for the brain, are particularly vulnerable. When these hair cells are exposed to intense noise, they can become physically damaged. This damage may include bending or breaking of their tiny hair-like projections called stereocilia, or harm to the synapses that connect these cells to the auditory nerve fibers. Temporary threshold shift is a reversible form of hearing loss that happens when these hair cells experience short-term overstimulation or fatigue from loud noise. For example, after attending a concert or using headphones at high volumes, you might notice a temporary reduction in your hearing ability. This can manifest as muffled sounds, ringing in the ears, or a feeling of fullness. Fortunately, after some rest away from loud environments, hearing typically returns to normal as the hair cells recover. However, repeated or prolonged exposure to loud sounds can lead to permanent threshold shift, where the hair cells and their connections are irreversibly damaged. This results in permanent noise-induced hearing loss. At a cellular level, exposure to loud noise leads to the buildup of reactive oxygen species and activates stress pathways within the hair cells. This can trigger programmed cell death or necrosis, affecting not just the hair cells but also the cochlear neurons, which can further contribute to hearing loss. Common causes of NIHL and TTS include exposure to loud music, whether at concerts or through headphones, occupational noise from machinery or construction, and sudden loud noises like explosions or gunshots. Recreational activities involving power tools or attending loud sporting events can also pose risks. Sounds above 85 decibels are generally considered hazardous to hearing, especially with prolonged exposure. It's important to note that tensor tympani syndrome, which is also abbreviated as TTS, is a different condition. It involves the involuntary contraction of the tensor tympani muscle in the middle ear, often triggered by sudden loud sounds. This syndrome can cause symptoms like ear pain and sound sensitivity, but it does not typically lead to hearing loss in the same way that noise-induced hearing loss does. In summary, noise-induced hearing loss results from both mechanical and biochemical damage to cochlear hair cells and neurons due to loud noise exposure. Temporary threshold shift represents a reversible stage of this damage. To prevent NIHL, it is crucial to limit exposure to loud sounds, use hearing protection, and allow time for recovery after being in noisy environments. Always consult a healthcare professional for personalized advice regarding hearing health.